The Mesa Igea Implant Surgical Kit. Complete and intuitive for an organized workflow. The devices are arranged according to the various steps of the surgical protocol. The first drill is the pointed drill needed for the incision of the cortical bone. Close, there are two spiral drills. Both have 2 millimeters diameter and are made to prepare the pilot hole of the implant site. Drill stops are available for the long spiral drill. The range of short and long-form drills of the Igea implant system is color-coded to match the specific implant diameter. The first series includes short-formed drills. The second contains long-form drills that can be used jointly with drill stops. The third color-coded series includes cortical drills, which use is recommended to widen the cortical collar and facilitate the insertion of the implant. The last color code series includes the bone taps, which are suggested for implant placement in dense bone. Next to the drills, there are 5 laser-marked drill stops. The length shown on the drill stops indicates the drilling depth, including the apical drill increment of 0.3 millimeters. These are the parallel pins for aligning the orientation and position of the osteotomy. After using the first spiral drill, insert the pin and visually check the position of the implant. They are available in 3 different angles: 0 degrees, 17 degrees, and 30 degrees. In the center of the parallel pin, there is a hole for the floss to pass through. Spiral drills and form drills have depth markers that correspond to the length of the available implants. The first marking, from the apex on the drill, corresponds to 8 millimeters. The second marking indicates 10 to 11.5 millimeters. The last marking indicates 13 to 15 millimeters. It's important to note that the drill tip is 0.3 millimeters longer compared to the insertion depth of the implant. In the lower series below the pins, there are contra-angle and manual screwdrivers. These allow tightening of cap screws, healing screws, and the abutments. Mesa Igea implants feature an internal hexagonal conical connection. They are available in 2 connection sizes: narrow for the 3.5 inches diameter implant and regular for the 3.8, 4.3 inches, and 5 inches diameter implants. There are 4 drivers for each connection size: 2 manual and 2 contra-angle, long and short. The contra-angle driver holds the implant. The manual driver is only used to screw in the implant. The engage of the driver is considered complete only when the conical part is no longer visible. An adapter that allows the contra-angle driver to be used with a ratchet wrench is available. Under the adapter, there is a drill extender which can be used to extend the overall length of the instrument and is compatible with handpiece instruments. Bone Profiler provides precise cutting of bone around the coronal site of the implant and creates an accurate and uniform emergence profile for proper seating of the restorative components. The Bone Profiler Guide has to match the implant connection size, narrow or regular. In the Mesa Igea kit, there are 3 devices for the placement of MU abutments. Both the manual and contra-angle drivers are used for straight MU abutment. The angled MU abutments have to be placed with MU positioner. In the lower level of the surgical kit are easily accessible depth probe and the ratchet wrench. The depth probe is designed to control the depth of the osteotomy in order to support the operator in the correct choice of implant length. The ratchet wrench allows manual tightening of different components. The Mesa ratchet wrench allows to change the direction by simply pulling out and turning the reversing part 180 degrees. The gray arrow always indicates the direction in which the force is applied. To obtain the desired torque value, apply force on the moving lever only. Ensure that the arrow on the reversing part points in the direction of the moving lever.